Hello and welcome. I'm Dr. Andrew Collins, a specialist in rheumatology and musculoskeletal health. If you've recently been experiencing nagging knee pain, morning stiffness, or joint fatigue after just a short walk, this video is for you. Osteoarthritis isn't just a condition of old age. It's a silent, progressive disease that develops over time. It can significantly impact your mobility and quality of life if left untreated. In this video, I'll walk you through everything you need to know from the root causes and symptoms to how the disease develops inside the body, and most importantly, what you can do to prevent or manage it effectively. Let's take this journey together towards stronger joints, better movement, and a life without limits. One, what is osteoarthritis? Osteoarthritis, often shortened to OA, is a chronic progressive joint condition that develops slowly over time. It's actually the most common form of arthritis, and it happens when the cartilage that cushions the ends of your bones gradually wears away. As this protective cartilage erodes, the bones in the joint begin to rub directly against each other, leading to pain, inflammation, stiffness, and reduced mobility. The joints most commonly affected include the knees, hips, lower back, neck, hands, and fingers. For example, knee osteoarthritis occurs when not only the cartilage but also the structures surrounding the knee joint, such as the subchondral bone, synovial membrane ligaments, and nearby muscles, become damaged. Common signs include surface irregularities on the cartilage joint space, narrowing subchondral bone sclerosis, and the formation of bone spurs. If left untreated over time, osteoarthritis can lead to significant joint damage and narrowing of the joint space. This results in chronic pain, limited movement, difficulty walking, and a higher risk of tripping or falling. In more serious cases, patients may suffer fractures and even disability. 2. What causes osteoarthritis? There are several major risk factors behind osteoarthritis. Aged people over 50 are at higher risk due to the natural aging process. Over time, repeated movement and friction in the joints wear down the protective lining, reducing elasticity and shock absorption. Genetics: if your parents or close family members have osteoarthritis, your risk is higher. Overweight and obesity: excess weight puts additional strain on weight-bearing joints like the knees and hips. Repetitive physical activity. Jobs involving manual labor, intense sports, or prolonged poor posture can lead to joint degeneration. Joint injuries: previous fractures, dislocations, or damage to cartilage, tendons, or ligaments increase the likelihood of developing osteoarthritis. Joint misalignment: conditions like bow legs or knock knees cause uneven joint pressure and accelerate wear. Sedentary lifestyle. Lack of exercise can weaken the muscles supporting joints and reduce joint flexibility. Unhealthy diet. Nutrient deficiencies can reduce joint lubrication, excess alcohol harms cartilage, and low vitamin D affects calcium absorption, all contributing to joint damage. Other medical conditions: diseases like rheumatoid arthritis, gout, or multiple joint inflammations may lead to secondary osteoarthritis. Corticosteroid overuse. Long-term use of corticosteroids increases the risk of joint degeneration. Hormonal and endocrine factors. Menopausal estrogen decline or diabetes can also play a role in joint deterioration. 3. How osteoarthritis develops: pathophysiology. The disease begins with damage to the cartilage, the smooth elastic tissue that cushions the joint. As the cartilage weakens and breaks down, 1. The protective layer between bones thins out. Bones start to rub directly. 2. The underlying bone thickens and forms painful bone spurs. 3. The synovial membrane becomes mildly inflamed, producing less joint fluid and reducing lubrication. 4. The surrounding muscles weaken, decreasing joint support and stability. 4. Signs and symptoms. Joint pain, a dull ache that worsens with activity or toward the end of the day. In more advanced stages, pain becomes severe and disruptive. Stiffness, especially in the morning or after prolonged rest, often worse in cold weather. The more advanced the condition, the more frequent and intense the stiffness. Limited range of motion, difficulty bending, straightening, or rotating the joint. Severe degeneration makes walking or basic movement painful. Mild swelling caused by low-grade inflammation of the synovial membrane. Grinding sounds. A clicking or crunching noise may be heard during movement. Joint deformity. In late-stage osteoarthritis, the joint may become visibly misshapen. 5. Diagnosis, clinical, and imaging. Clinical diagnosis. History: taking pain worsens with activity, morning stiffness lasting less than 30 minutes. Physical exam: mild swelling, reduced joint mobility, and crepitus during movement. Imaging and laboratory tests. X-ray shows joint space, narrowing bone spurs, and subchondral sclerosis. MRI detects early cartilage damage, joint fluid levels, and synovial inflammation. Joint ultrasound assesses fluid buildup in synovial membrane. Blood tests used to rule out other types of arthritis, such as rheumatoid arthritis. 6 treatment approaches. 1 non-pharmacological treatments. Weight loss if overweight. Reducing body weight can significantly decrease joint load, especially in the knees and hips. Physical therapy. Focus on stretching tight muscles and strengthening the muscles that support the joint. Gentle exercises. Activities like walking, swimming, or yoga help improve flexibility without overloading the joints. Hot or cold compresses help relieve pain and stiffness. Supportive devices such as braces, walking, sticks, or joint support bands to reduce strain during movement. 2 medications. Paracetamol acetaminophen for mild pain relief. NSAIDs non-steroid anti-inflammatory drugs like ibuprofen or diclofenac to reduce inflammation and pain. Glucosamine and chondroitin sulfate supplements that may support cartilage. Health effectiveness varies from person to person. Hyaluronic acid injections act as a lubricant inside the joint to improve mobility and reduce pain. Corticosteroid injections provide strong pain relief for short-term use during flare-ups. 3 surgery for severe cases. Arthroscopy, a minimally invasive procedure to remove damaged cartilage or loose fragments from the joint. Osteotomy, realignment of bones in cases of joint deformity to reduce uneven pressure. Joint replacement prosthesis, recommended when the joint is severely damaged and no longer functional. 7. How to prevent osteoarthritis. Osteoarthritis can significantly affect your ability to move, lower your quality of life, and even lead to disability. Fortunately, many risk factors are manageable. Here are some preventive tips. Maintain a healthy weight. Excess weight increases the load on your joints and accelerates wear and tear, especially in the knees and hips. Keeping your weight under control is one of the most important ways to protect your joints. Exercise regularly and appropriately. Gentle, low-impact activities help keep joints flexible. Avoid overexerting or high-impact exercises that could damage joint structures. Follow a balanced, nutrient-rich diet. Ensure your meals are rich in calcium and essential minerals. Cut back on alcohol, stimulants, and greasy foods that contribute to weight gain and inflammation. Change your posture or position every 30 minutes. Whether sitting or working, avoid staying in one position too long. To prevent stiffness and joint fatigue, get regular health checkups. Early detection through regular medical evaluations can make a huge difference in slowing disease progression. Wet conclusion. Osteoarthritis is a chronic condition that cannot be fully reversed, but it can absolutely be managed. Early detection, proper treatment, and a proactive lifestyle can help slow down joint degeneration and preserve mobility. Taking care of your joints with healthy daily habits, proper nutrition, and regular medical follow-up is the key to staying active, pain-free, and independent at any age.